maintained, that operates, and that is reactive. Human resources that are qualified and motivated, as well as trained for handling emergencies based on the specificities of the emergencies are required. A general physician is an expert, but you also need special skills. In addition, you need other inputs like blood and other medical products, drugs, and resuscitation techniques, so that hospitals are more reactive in their operation. Once we witnessed this in the hospital sector, we saw that there were blood banks that were not operational. So what happens when a lady comes in labor and is suffering from bleeding, severe bleeding? So at the local and national level, we need to ensure that hospitals are reactive. They need to be better equipped, have more personnel, have the supplies that are necessary so that they are reactive and quick in their response. We developed a module, and I can tap into that experience in the service of WHO Africa region. And of course, we will need finances. And the financial systems will be put in place in this regard. Thank you.
I shall now give the floor to Côte d'Ivoire to ask the question.
Madame la Présidente. Bonjour, Docteur.
Good morning, Madam Chair. Good morning, Dr. Dramé. My question is on human resources. What is your strategy to attract and retain young talent? You know, seeing the demotivation that we have right now on our services, and also seeing the constraints following the American withdrawal that is weakening WHO at the global level.
Merci bien, Monsieur le Représentant.
Thank you. Thank you, representative of Côte d'Ivoire. Well, I'm not sure who is really asking the question, but I've had the privilege of working in Côte d'Ivoire. So he is Professor Samba asking the question. So I've had occasion to work on the recent National Health Development Plan of that country, a country that has structures, undeniably, but like any other African country, our countries, we have challenges that we need to overcome. One of them, a big one, is human resources. We are understaffed, you know, based on WHO norms and standards, and our skills are not enough, and the distribution is not equitable within the countries. First, collaboration between the human resource training institutions and then the universities, the midwifery schools and nursery schools and others. And on the other hand, we also have difficulty managing and distributing human resources because in many countries, especially French-speaking countries, it is the public service that takes a number of institutional decisions. So we need to have an institutional dialogue on this point. That is the first point. Then on the other side, we have personnel, staff members who come with ambition, hope, and a lot of other things. And so we need to address the issue of motivation, training, career development plan, and motivation to those who would go to remote and hard to reach areas. We've seen in some countries, indeed, that when they graduate from training, workers are obliged to go to the rural areas, but they should be supported, through training, motivation, and through working and living conditions, And so you asked me, where would the money come from? And precisely that's what I was talking about from the very beginning. We, as the African region, and WHO is ready to support us, we should organize a special conference on funding the health systems, and especially the human resource sector. But I believe we need institutional reforms, organizational and technical reforms to ensure that the human resources that we have, that we train them more, encourage them more, motivate them more, so that we can distribute them better all over the countries. Thank you, Professor Samba, for your question.
I shall now give the floor to Uganda to ask the question. Uganda, the floor is yours.
Thank you, Dr. Dramé, for the presentation. My question is, in addition to the funding mechanisms you proposed as diaspora and the funding conference for African Union, which other innovative way will WHO financing do you bring to this position, given the dwindling financial deposition from the whole of the world? The global geopolitics taken into account, what are the new innovating financing mechanisms that you think you will bring on board? Thank you.
Thank you, sir, from Uganda. This question is crucial. It gives me the opportunity to elaborate on more what I've already said. It's true that I've mentioned that the diaspora should contribute. The financial contribution of the diaspora should be considered in health sector financing. That's crucial. But we should go beyond that. We have innovative financing sources. For example, taxes. Or we know that, for example, whatever the economic activities, plane or tickets or other kind of activities, or mobile phone utilization and etc. All these enterprise, all of these structure, we should discuss clearly with them, not stressing them, because we have to allow all the private sector to invest in our countries. But clearly, strategically, we should discuss with them how we can have a sort of return of all what they pay as taxes to health sector. But as for that, that's not automatically. The health sectors, accompanied with the WHO country office or regional office, and in collaboration with the headquarters, but our region, our countries, and the other technical and funding partners, we should discuss calmly with them to have a return through structured and organized dialogue, how they can invest in our health sectors. And also, we have, as I said, people, some colleagues or some Africans who have money, who have more than billion. We should approach them for discuss with them how they can contribute the health of their continent. Let's see what is happening with Bill Gates. Why not Africans? We have Africans who also have money, have billion. We should calmly, strategically, institutionally, with the private sectors when they discuss with them, and all that in all levels, at community level, at regional level, at country level, at the continental level. Thank you very much, Mr., for your question.
We have time remaining for just one more question. So I shall give the floor to Cameroon to ask the question. Cameroon.
Merci, Madame la Présidente, pour cette
Thank you, Madam Chair,
opportunité que vous nous donnez.
for this opportunity that you're giving us.
Je voudrais demander aux candidats,
I would like to ask the candidate that following the withdrawal of the United States from WHO and the suspension of US funding for the management of some chronic conditions such as HIV, tuberculosis, and malaria, I'd like to ask, what position would you advise the African region to take in terms of strategy, in terms of risk of managing these patients, and even our plan to locally produce vaccines and medical inputs, because you know that we've been carrying on a number of reflections. So I would like the candidate to tell us precisely what his strategy is. What strategy would you advise the African region to have at this time? Thank you. Thank you very much for your question, which is topical and that I've mentioned before. I believe that in the coming months, if things don't change, we have about 5 or 6 countries in Africa who don't have any more access to antiretroviral treatment for HIV, as I mentioned earlier. And it's the same thing in the long term for tuberculosis, maternal and child health. And so this just happened. So we need to react. In the first 100 days, immediately, if I have the honor of being elected, in the first 100 days, we'll organize a conference to discuss all these issues. Not only to implement health diplomacy, but also find ways of fostering local production of medicines, but in some kind of pooling mechanism, not individually. No, we will do it in a pooled mechanism so that we can have local production of medicines, vaccines, and medical products. So this is an obligation, and we should consider it an opportunity. We should consider it calmly, and calmly organized through health diplomacy, through dialogue with all sectors, public, private, and the others. We should open our eyes to other partners. Yes, within the country, but why not go to the Gulf countries? Why not China? Why not other actors that are willing, and leave the door open to the United States when
Dramé,
it will be ready to come?
Summarize, the time is up. So the total time for this interview has been exhausted. Thank you very much, Dr. Dramé, for being with us today. And this concludes the first half of our section. We're reconvening in 30 minutes with the interview of Professor Janabi Mohammed Yakub, proposed by the United Republic of Tanzania. Thanks for being with us. We'll have a short break for 30 minutes. Welcome back. I hope you had a short but restful break. We can now resume with this live virtual forum for candidates. We now proceed with Professor Yakub, proposed by the United Republic of Tanzania.
Honourable Chairperson, Dr. Louise Mapleh Kpoto, Honourable Ministers, Dr. Chikwe Kuhezu, Regional Director, ADIM, Interim, ladies and gentlemen, all protocols observed. A very good afternoon. Bonjour, bon dia, jambo. At the outset, allow me to begin by thanking the WHO-AFRO Region Committee for giving me the rare opportunity and privilege to be one of the contestants for the position of the Regional Director. I would like also to pay tribute to a truly distinguished colleague, Dr. Faustin Ndungulile, the former Regional Director-elect. His ultimate passing is what necessitated this electoral process. His memory will continue to inspire us. I sincerely thank every one of you who offered their condolences. Honorable Chairperson, as introduced, I am Professor Mohamed Yakub Janabi. I bring with me 30 years of experience in health and leadership. From humble beginnings as a young GP, I rose through the ranks to become a prominent healthcare executive, public health specialist, a cardiologist, scientist, health diplomat, a researcher, academician, and author. I'm very much aware of the health challenges facing the people of our continent. I've lived them. I'm currently dealing with them every day during my practice. Honorable Chairperson, in my extensive work in public health and leadership, I've always been driven by the vision and ambition to have a healthier, more resilient, and prosperous Africa. I believe I can make important contributions if elected, guided by Sustainable Development Goals, Global Program of Work 14, and Africa Health Strategy. I uphold health as a human right for all, including people with disabilities, while embracing gender equity and equality. I'm committed to ensuring universal access to quality healthcare and strengthening health systems to meet the needs of the present and future generation. Honorable Chairperson, I commend the WHO in collaboration with the government and other stakeholders for its outstanding work in improving health outcomes and well-being, as evidenced by the significant progress made across various health indicators. However, today, Africa stands at a turning point in its history because of the complex challenges that call for an urgent and collective action. These include financial crises we see, geopolitical instability, impacts of climate change, infodemics, the growing issue of antimicrobial resistance, the pressing realities of pandemics, and other public health emergencies. Honorable Chairperson, I've been a senior advisor on health policy and nutrition to the former President Jakaya Kikwete for 10 years, from 2005 to 2015, and currently to President Samia Suluhu Hassan. I've had the opportunity to advise the highest political office in our country on the transformative needs in the health sector. This position has allowed me to spearhead initiatives which have impacted positively in the fight against health crises and establishment of systems that continue to deliver tangible results. So what qualifies me for this service opportunity? I believe that Africa, where it stands today, deserves a leader who not only has the vision, but also the proven ability to deliver results with efficiency and transparency. The challenges we face as a region today demand a bold and practical leadership. Someone who understands the realities on the ground, someone who can work with government and other stakeholders to mobilize resources, and someone who can create tangible partnership to address them. I believe I'm such a leader. During my practice, I've witnessed people missing out on healthcare for lack of finance, and families parting ways with their possessions, the very means of livelihood, just to pay hospital bills. Yet, despite making these heartbreak sacrifices, many still find themselves trapped in debt and poor health conditions. For me, this is an harrowing experience. Out-of-pocket healthcare costs have pushed countless families into the depths of extreme poverty, thereby recycling poverty. This requires urgent solution. I believe universal care is the solution. Honorable Chairperson, I have a long experience in training, research, and working abroad, followed by many years of hands-on fieldwork across the African region. Throughout my careers, I've worked with heads of states, ministers, parliamentarians, community health workers, philanthropies, private sectors, NGO, civil societies, financial institutions, and faith-based organizations. My track record includes transforming healthcare systems from the ground up, even in the extremely challenging and resource-constrained environments. How did we do it? By pioneering innovative healthcare financing, building a stronger health workforce, building infrastructure, initiating outreach services, and successfully managing public health emergencies. So what gives me assurance in my track record? Trust is built on results. My contribution to healthcare is undeniable. I understand the challenges ahead. I bring the new resolve to address them. I'm not only ready for this challenge, but also uniquely equipped to address them and deliver the transformative change our continent urgently needs and expects from us. Having visited many member states, over 30, I recognize the urgent need for a fundamental shift in how WHO-AFRO responds to specific country needs. I will drive this transformation, ensuring a more agile, country-focused, country-owned, and impactful organization. Chairperson, now I would like to highlight some key personal experiences and achievement. My first point is on strengthening health system. As the founder and first CEO of the Jakaya Kikwete Cardiac Institute in 2014, we were able to reduce overseas referrals by 95%, saving the country more than $10 million per year. The funds saved are now being reinvested in strengthening PHC and financing patients who cannot afford hospital bills. Again, how did we do it? By building in-house human capacity, investing on infrastructure, advocating for an increase of health budgets, engaging private sector, financial institutions, and fostering global collaboration. The Institute has become a regional hub that performs more than 4,000 intervention procedures and open heart surgeries annually, ranging from pacemaker insertion to bypass surgery. Currently, it serves patients from across Africa. Honorable Chairperson, in 2022, I was appointed CEO of Muhimbili National Hospital, one of the largest hospitals in the region with 2,400 beds and 4,000 staff under me. The hospital attendance on average is 3,000 patients per day. Furthermore, I oversee an outreach to a network of 12,200 satellite healthcare facilities across the countries through telemedicine, e-medicine, and artificial intelligence. Our plan is to build a brigade of 137,000 community health workers by 2030. These workers are going to serve as a bridge between the community whom we serve and the formal healthcare system. Honorable Chairperson, this year in January, under my leadership, we secured $363 million from a non-traditional financer, the Republic of South Korea, for health system strengthening on favorable terms of 0.01% interest, 15-year grace period, and 25-year repayment. This innovative financing will transform Muhimbili and its satellite facilities into a regional hub for preventive, protective, curative, and rehabilitative services, aligning very well with the GPW 14 objectives. If elected, I will endeavor to engage such non-traditional funders from within our region and outside the continent. In the research and advocacy domains, I co-investigated HIV vaccine trials in Tanzania and Mozambique in the early 2000s. Later, in 2012, my advocacy led to the then sitting President Jakaya Kikwete to publicly undergo HIV testing. This reduced stigma inspired 5 million Tanzanians to seek counseling and testing within a year. Likewise, the story repeated itself. In 2021, President Samia Suluhu Hassan openly championed and publicly received the COVID-19 vaccine, significantly increasing its uptake across the country and reducing infodemics. My second point is emergency preparedness. In 2015, the UN Secretary General Ban Ki-moon appointed President Kikwete to lead a UN high-level panel on global health crisis after the Ebola outbreak in West Africa. As a senior advisor, I visited the affected countries of Liberia, Guinea, and Sierra Leone, gaining invaluable hands-on experience, and the panel's recommendation contributed to the efforts to transform the WHO approach to managing emergency crises that we observe today. My third point is on demographic response. The African continent is experiencing a demographic transition with its youthful population, offering both opportunities and challenges. Now, when you have a young population, it can drive growth and innovation. It's also highly exposed to risk factors such as substance abuse, unprotected sex, teenager pregnancy, mental health disorders, to mention a few. On the other side, as the population ages, it is crucial to prepare our healthcare systems to address the needs of older generation. My fourth point is on fresh perspective. I am ready to champion fresh ideas and innovative approaches that can revitalize our organization and drive impactful reforms. My work in Tanzania, advancing PHC, along with my experience abroad, has given me a first-hand insight into the barriers to healthcare access and their profound impact on our communities. Honourable Chairperson, the challenges ahead are so broad and multifaceted. A member state or any organization cannot manage on their own. To address them effectively, we must act together in bilateral and multilateral relationship. I'm committed to addressing the challenges by focusing on my 7 key priorities presented in no particular order. My first priority is universal health coverage and the SDGs. With less than 5 years remaining to achieve the SDGs, many indicators show we are off track on achieving them. In our region, for example, the universal health service today is 46, while the global index, 68. Globally, today, 4.5 billion people lack full access to essential health services, half of the world, with 1 billion experiencing catastrophic out-of-pocket expenses, pushing families into poverty. I'm committed to the achievement of universal health coverage. My second priority is sustainable financing. Our current financing model faces persistent challenges, worsened now by the acute shift of global financing policies. Currently, 80% of the WHO budget relies on voluntary contribution, many of which limit our autonomy of earmarking because of earmarking. Member states' assessed contribution is only 20%, and sometimes even less. So sincerely, I support efforts to increase the assessed contribution, which is going on. As for supporting member states mitigating the catastrophic decline in external funding, I will work with governments to secure diversified funding through health insurance schemes, public-private partnership, blended financing, debt for health swaps, and global debt cancellation. This will help bridge resource gaps and offers our region a valuable opportunity to establish a resilient, self-sustained health financing system. My third priority is strengthening emergency preparedness. We must strengthen our health system through strong health workforce, disease surveillance, intelligence system, enhanced rapid response mechanism, cross-border cooperation, and sharing the best practices. My priority will include championing of implementation of the amended IHR and supporting the development and implementation of the pandemic accord. My fourth priority is maternal child health and nutrition. Africa bears 70% of the maternal deaths, 56% of under 5 deaths worldwide. Additionally, the high prevalence of stunting compounds these challenges with profound implications for the continent. However, amidst these grim statistics, there is a beacon of hope. In Tanzania, maternal mortality dropped by an impressive 80% between 2015 and 2022, a testament to the transformative power of primary health care and strong political commitment. In recognition of her able leadership in this, President Samia Suluhu Hassan was awarded the prestigious Goalkeeper Award in 2024. My fifth priority is combating communicable, non-communicable, and neglected tropical disease. Through robust disease control strategies, promotion of healthier lifestyle, and a One Health approach that recognizes interconnectedness of human, animal, plant, and the ecosystem, I will work with the governments and partners to address the high burden of these diseases by implementing a comprehensive cross-sector strategies for prevention and control. My sixth priority is tackling antimicrobial resistance. Now, this is a crisis unfolding in a slow motion. Currently, it's responsible for 1.2 million deaths annually. This is compounded by the lack of surveillance data in 40% of our member states, leaving gaps in understanding the extent of the problem. I will support the establishment of the regional databases and efforts to combat the crisis. My seventh priority is building local manufacturing capacity. What did COVID teach us? COVID revealed critical gaps in our local capacity to manufacture diagnostics, therapeutics, and vaccines. Over 90% of these public health products are imported, and this heavy reliance poses a significant threat to our region, to both supply chain stability and health security. Hence, boosting local production is the key to economic growth. I believe it's high time to involve our non-traditional partners, including the diaspora healthcare world, who can contribute significantly through expertise, training, and mentorship, thereby strengthening health systems and promoting sustainable development. I'm a living example. I'm a Tanzanian diaspora. I will leverage health diplomacy to catalyze health system strengthening, partnership, and elevating Africa leadership in global health governance. Honourable Chairperson, allow me to conclude by extending my heartfelt congratulations to Dr. Moet and our team for the inspiring leadership and outstanding contribution, to all WHO-AFRO member states, WHO staff at all levels, and collaborating partners. If elected, I look forward to working with you. I extend my profound gratitude to President Samia Suluhu Hassan for placing her trust in me. I humbly ask you for your vote on the 18th of May 2025. Together, we can shape a brighter future for Africa. Together, we can have the power to transform our mother Africa. Thank you. Merci beaucoup. Muito obrigado. Asanteni sana.
Thank you, Professor Yakub. We'll now continue the interview with questions and answers. I will now pull the first token with the name of the regional committee member which expressed their wish to ask a question to Professor Yacoub. Côte d'Ivoire.
Savoir expérience dans la gestion des urgences au niveau
to find out more about the management of emergencies. What would your strategy be to respond to the various emergencies? Speaker's sound is intermittent. We apologize. Perhaps the Honourable Delegate from Côte d'Ivoire could adjust his sound.
So can we come back to Côte d'Ivoire after we ask another member state to ask a question?
Je suis audible maintenant.
I will now give the floor to Ghana to ask the question. Ghana.
Hello.
Ghana. Ghana, you.
Yes, I just want to thank you for the opportunity to ask this question from the Ghana team to our candidate. I want to thank you for the lucid presentation. But straight to the point, I just want to ask Prof, in a brief sentence, what legacy would you like to leave as WHO Africa leader who is trying to lead the region? And also, how would you measure the impact of your leadership on the health and the well-being of the people of Africa? As our leader for the region, and how would you measure the impact of your leadership on the well-being of our people in the African continent? Thank you very much.
Honourable Chairperson, thank you for the question. A very good question from Ghana. My answer with this, what legacy do I want to bring? The first thing, I'm trying to look what is happening to the world today, what is happening to our region today. One of the things which I'm going to leave after my 5 years or 10 years, depending, is to leave our continent dependent, self-sufficient, by domestic financing, innovative way. I want to see, as I said, 4.5 billion people are pushed into poverty. Majority of these people live in our continent. It concerns me. Do we have a way to get out of this? Yes. By being independent, by increasing our workforce. We have to invest on community health workers. Because if we are talking of primary health care, which is a backbone of universal health coverage, we have to prevent the disease. And the only way we can do it is by strengthening Africa workforce for transformation. I would employ innovative strategies to build a resilient health workforce, particularly the community level, empower the community health workers, enhance retention and motivation. Why our people are leaving? Motivation, one of them, infrastructure has to be better, has to be equipped. by task shifting. We have to invest on education and research, expanding, because we are talking of evidence-based medicine. We have to foster on our regional collaboration. I'm going to invest on mapping. What is Ghana having, which Tanzania doesn't have? What is ECOWAS having, which East African Community doesn't have it? Or the regional economic communities. We have to work with African CDC, the African Union, and strengthen our policies, which will help countries to develop national workforce strategies, advocate on increased government support and resources for health. Look at Abuja Declaration, more than 2 decades now. So what can we do? And in order to fill the gap, one of the approaches which I had suggested in my manifesto, we have to have a discussion on debt relief. Because now, our region, we are using a lot of money servicing the debts. Can we do debt swaps? Debt for health? So these are very crucial. But if you look on what is happening now, I think one among is planning. What actions can be taken immediately?
Thank you for answering the question. Can we go back to Ivory Coast? Ivory Coast, are you ready?
La Côte d'Ivoire est prête. Est-ce que vous m'entendez correctement?
Côte d'Ivoire is ready. Can you hear me clearly? Asks the speaker. Thank you.
Yes, we are hearing you.
I would like to ask a question to the colleague from Tanzania. What is your experience in handling health emergencies? And what would your strategy be to responding to the numerous emerging emergencies like Mpox, EVD, cholera, that are linked to political and health crises? So I'm talking about emergencies in our various countries. Thank you very much.
Honourable Chairperson, Honourable Minister from Côte d'Ivoire, addressing health securities, threats such as pandemics, which you have just imagined, emerging diseases, antimicrobial, requires a robust leadership, a coordinated one with a One Health approach, and very well-resourced systems to effectively detection and response. Now, I'm a living example. 2023, Tanzania had Marburg. This year, the one which I'm talking, we have Mpox, which we have just declared. So what have we done? First is strengthening our health security system. So we're collaborating with member states to build capacities in disease surveillance, laboratory and diagnostics, rapid response, and this is exactly what we did. We had regular simulation, and after action reviews, we had a lot of stockpiles in the regional, so we didn't have to run. I'm living in Dar es Salaam, for example. The place where Marburg occurred is 1,400 kilometers. So enhancing the regional stockpiles, logistic enhancement, it helped very much in managing Marburg and Mpox outbreaks in 2023 and 2025. The regional collaboration is very important because in October, there was an outbreak in Rwanda. So we have to approach it in a multi-sectorial way, in a One Health approach. Building our own capacities, this is very important. Health workers development, scalable emergency response system. I spoke about fostering the regional and international collaboration, monitoring, ensuring accountability, and establishing metrics for preparedness. So engaging the community and the risk communication, it's very crucial in facing the pandemics. Because of time, I haven't spoken about can prepare any country about the surveillance. I spoke in my manifesto. We have to increase the intelligence which will help us in rapid response.
Ashanine gave the floor to Guinea to ask the question. Guinea, are you there? Guinea, can you kindly unmute yourself? Guinea? Please check and see if you are muted. I will select another member state and come back to Guinea later. I will now give the floor to Zimbabwe to ask the question.
Thank you, Chair. Thank you to Janabi for the presentation. The looming challenge of antiretroviral therapy following the United States government promulgation is a reality. What measures can be put in place to ensure equitable access to ARVs for the marginalized population, especially the low resistance in low resource settings? Secondly, how all changes in policy affect the affordability of ARVs and patients, and what can be done to mitigate from the financial barriers created? Thank you.
Madam Chairperson, I missed the first part of the question. Is it on financing on the ARVs? Can the question be repeated, please?
Okay. Sorry. What measures can be put in place to ensure equitable access to ARVs for the marginalized population, especially in the low resource settings? Thank you.
Thank you, Madam Chairperson. Thank you, Minister or Delegate from Zimbabwe, for the question, what can we do to put in place for the marginalized people who are very important, and is in my manifesto too. So I think the first thing I'll go to is address the primary health care. Because where do these people live is in the community. So addressing primary health care and universal health coverage requires a comprehensive approach. I do have first-hand experience working with two presidents, 13, 14 years now. Just to cite a few examples, the past few years, we have built about, around more than 8,000 centers. So what do these centers do? One, it will strengthen the foundation of PHCs, invest in community health workers, equip the primary health care facilities, promote telemedicine where it's far to reach these digital people. But crucial, which we are in crisis now, advocate for increased domestic financing. Budget allocation, encourage the government to allocate the Abuja Declaration, which was 15%. Improve accessibility and equity. Establish more primary healthcare facilities and mobile clinics in remote areas to support the national insurance schemes for the vulnerable. We have to strengthen the health system for resilience. You need workforce development, data-driven decision-making. We have to accelerate towards universal health coverage. our policies, our legal frameworks to support an embedded universal health coverage principles in the health policies. We have to foster a multi-collaboration. But for example, Madam Chair, if allowed, what we have done quickly after this crisis to try to look these vertical programs. I don't say all vertical programs are bad, but can they be integrated to our normal services? Because it will bring these patients to our normal systems, which are funded by most of the government. So adaptation, I will really discuss on the flexibility when crises or challenges happen, whether it's a pandemic or a climate change. So we have to have a very resilient system which can cope not only with the climate change, but like the financial crisis which has just happened. How can we cope fast? How can we adapt with the situation?
We will now ask Guinea if you are available. Can you come back and give your question? Kindly unmute yourself, Guinea Conakry. If Guinea is not available, I will.
Hello? Hello?
Yes, hello?
Hello?
We can hear you.
Oui, allô? Oui, bonjour à tous. Félicitations.
Greetings to everyone, and I'd like to congratulate all the candidates who've made their presentation. I'm the Minister of Health from Guinea. I hope you can hear me. Can you hear me? Kindly confirm.
Yes, we are hearing you.
D'accord, vous m'entendez?
Thank you. I have a question for the candidate regarding financing of the health sector. From 2001 in Abuja, governments were supposed to allocate 15% of their national budget to health. Unfortunately, not all countries have honored the 15% pledge. What strategy would you as a candidate put in place to ensure that countries commit to the 15% allocation to the health sector? It's just the first question. My second question is the coordination of...
Guinea Conakry, you are permits me to kindly ask you, you are entitled to only one question. I'm sorry, just one question.
Okay. Thank you.
Thank you, Honorable Chairperson. Thank you, Minister from Guinea Conakry, for a very valid and important question to our region. It's true, Abuja Declaration requested our countries, respective countries, to finance at least 15% from our budget. So it's if elected, our member states are 47. Not all of them are equally in economic sense. So I think the first thing which I would like to do is a country specific. Honorable Minister, I will listen to you. I will talk to you. So I will go for each country specific. For example, there are countries I'm going to engage them in strategic resource mobilization. Work to diversify our funding sources by engaging both our traditional and non-traditional, including international donors, the private sector, the philanthropic organization. So I would advocate for increasing the domestic budget. I've discussed a little bit about what happens with our debt. Can we discuss about cancellation or swap of the debt? Because how much our countries are spending on servicing the debt. Can I take that fund and put it in the 15% which is required? I will foster the public-private partnership to bring an additional source for our health, which automatically will secure our health security. I will enhance coordination and international partners. We have to strengthen our partnership with multi-organizations like Gavi, the Global Fund, and other UN agencies. The African Union is there. Support on innovative in resource utilization. We have to encourage adoption of innovative, cost-effective solutions to maximize the use of the little available resources we have. We have to strengthen our monitoring and accountability. One of the things which our partners sometimes worry is our accountability. Can we be more transparent? Can we do more audit to our accounts? Can we put our accounts open so that we can build the faith or the trust which our donors sometimes do? But whichever way we want to look, the innovative domestic funding, we just got a wake-up call with the current crisis which is happening. I think we have to look at it in a more wider. We have estimated 40% of the minerals are from our continent. How much are we using it? Added value, levies, can we direct this fund to the health? So I think, Honorable Minister, I'll come to you with great humility. I will listen to you. I will listen to your advice. But together, I think there is a way for our region to be more financially self-sufficient. Thank you, Madam Chair.
Time for this interview has been exhausted. Thank you very much, Professor Yako, for being with us today. We'll now proceed with the interview of Professor Moustafa Majiyawa, proposed by Togo. Professor Moustafa, you have the floor. We aren't hearing you.
Merci, Madame la Présidente.
Thank you, Madam Chair. I hope you can hear me.
Yes, you are clear.
Merci, Madame la Présidente.
Thank you, Madam Chair. At the outset, I would like to convey once again my condolences on the passing of our brother, Faustin Dugulile, and to pray for the repose of his soul. His vision and commitment for health in Africa were extraordinary. I would like to pay tribute to Dr. Moiti for the work she did, and to pay tribute to my brother Chikwe for the acting role, and pay tribute to Dr. Tedros for the work that he's been doing for many years at the head of the World Health Organization. Honorable Ministers, Madam Chair, delegates from member states of the African region of WHO, thank you for the opportunity that you're giving me to discuss with you on what I hope to do at the head of WHO in the African region if you bestow your trust on me. And the happy and extraordinary thing is that circumstances have led me to understand our organization and many of you over the past few years, during which I had the privilege to be Minister of Health in Togo. And in that capacity and within that period, I had the time to conduct 11 key actions, flagship actions at the head of the ministry. That's to transform the mode of management of our health facilities based on the contractual approach, which is one of the recommendations of the WHO 1973. That reform was motivated by the situation that we've discovered and, what was happening in the hospitals and the performance of the hospitals. So the reform had to do with leasing out these facilities to a private company to manage it in an inclusive manner. And while the state, of course, maintained its sovereign prerogatives. And the reform led to a net improvement of the 8 hospitals that were leased out for management, and an improvement in the number of consultations, an improvement in lab analysis, improvement in X-ray, availability of medicines, reduction of bad practices. And these reforms led to adjustments as we went along. The results of this contracting out, or this outsourcing, was established by an assessment that was made by WHO at our request. And we were able to present these results at the WHO Regional Committee for Africa in 2022. And they were also recorded in a book published by Hamatan Publishers. And in a bid to share our Togolese experience, I would like us to share that experience. And second key action was the effective management of 2 major epidemics, meningitis, 2016, and another one in 2023. The third key action was tackling neglected tropical diseases, and Togo being the first country to eliminate 4 of these diseases, dracunculosis, trachoma, and human African trypanosomiasis. And a prize was awarded to the head of state of Togo by the Director General of WHO at the regional committee session in 2022. Furthermore, Togo is on track to eliminate 4 other diseases: onchocerciasis, schistosomiasis, leprosy, and yaws. Fourth major action is the effective and integrated management of populations that are facing terrorism in the north of the country, using the One Health approach and using concerted actions, bringing together several ministries. Fifth key action is the organization by Togo of the regional committee meeting in 2022. Sixth key action, close collaboration for purposes of efficiency between the Ministry of Health and training centers, medical training centers, and between the Ministry of Health and technical and financial partners. Seventh key action, efficient use of human resources through the assignment of qualified workers to regional hospitals. Eighth key action, the opening of paramedical schools in each of the economic regions of Togo, preparing the workers mentally to work in rural areas and in remote areas. Ninth key action, mobilization and management of financial resources that has led to increased confidence of partners and attracted investments. 10th key action, universal health insurance, implemented as from 2011, before it was progressively extended to the informal sector, and then its generalization to the entire Togolese population since January 2024. 11th key action, the Lomé initiative in January 2020, that is the fight against substandard and falsified medicines. The role of minister that I held for 9 years was preceded by care activities in research in the university where I was since 79. Care activities within the University Teaching Hospital Sylvanus Olympus in Lomé, which is the biggest hospital in Togo. And then a consultant that I was for about 25 years, and within the hospital setting within that period. Then I also carried out teaching activities, you know, as a rheumatologist, and then participation in 8 panels for aggregation, you know, for the title of professor, and management for over some 30 years in a big medical center in Togo. Our research activities led to the publication of 150 research works and also other works on health facilities in Togo. On the continental level, I have taken part in all sessions of the Regional Committee for 9 years, the World Health Assembly for 9 years also, and I chaired the first Interministerial Conference of Africa CDC and the selection panel for the Director of Africa CDC, that is Jean Kasseya, whom I greet. Madam Chair, honorable ministers and delegates, it is on the basis of these assets that I would like to request your trust and your support to head the WHO African region for the next 5 years. My ambition is to make our continent a space where access to health is made possible for all by means of an efficient and resilient system through a program aligned with the Sustainable Development Goals and the 14th General Program of Work of WHO. We will strengthen our achievements and innovate by connecting WHO support to the specific reality of each country. And for that purpose, my priorities are the following. The first priority is an efficient and resilient health system by supporting member states for the following measures. Investing more in health by increasing the domestic budget allotted to health, but through innovative mechanisms also, and making them effective. I intend to impose taxes on cosmetic products, in addition, of course, to the taxes on alcohol, sugary drinks, and the rest. Using public-private partnership to mobilize and manage resources. You know, the whole state structure has shown its limits. I mean, rigorous management and the principle of accountability and responsibility, as the current situation actually makes it imperative and necessary, without forgetting that the best way to mobilize resources is proper use of the systems that we have. Training, attraction, retention, and effective use of human resources. Evaluation together with universities and higher education institutions. The real impact of university systems on the health system. Intersectoral collaboration with the Sustainable Development Goals, notably connected to health, poverty, food, safe drinking water, and education as part of the One Health approach. Use of artificial intelligence, especially in terms of optimal use of specialists through telemedicine. Contextualization through combining the support of partners to national plans, with WHO serving as a lead. Second priority of my strategy, universal health coverage, motivated by the need of equity and for social cohesion, and the key role of health in development, which has been proven beyond doubt today. This coverage shall be undertaken through strengthening political commitment, through national strategies, and the implementation of a monitoring and evaluation mechanism. Third priority, tackling epidemics and disasters and promoting health security, notably by strengthening country preparedness through adequate structures and tools, promoting a fund for disasters that can be easily mobilized, and taking into account antimicrobial resistance. Fourth priority, effective measures to reduce the impact of diseases, communicable and non-communicable diseases, as well as accidents resulting from road traffic injuries that are very common in our African region, through policies of prevention, strengthening of personnel and technical capacity of hospitals, promoting mother and child care, care for older persons, hygiene and sanitation of the environment, participation of the community, development and implementation of plans for community health workers related to the policy of decentralization, and fifth priority, local production and rational management of drugs, vaccines, and inputs through, notably, regional centers, promotion of a policy of pooled procurement of health, of medicines, promotion of traditional medicine and traditional medicine research, fighting against substandard and falsified medicines, notably related to the LUME initiative, the African Medicines Agency, and international conventions in this area. Regional implementation and sub-regional implementation of measures to regulate the medicines market. Sixth priority, tackling the determinants of health, notably those related to climate change, which serves as disease vectors to communicable and non-communicable diseases through heat waves, hurricanes, flooding, deforestation, drought, pollution of the air, water, and the soil. And this struggle should be conducted through the One Health strategy. And lastly, seventh strategy, WHO governance and administration. We need to consolidate and build on the achievements, notably those achieved under my sister, Dr. Matshidiso Moiti, to whom I pay tribute, making the Secretariat more efficient, and bringing to the fore collaboration with member states, taking into account the realities, the needs, and the specific conditions of each country, and making more fluid while respecting the procedures of the organization, strengthening collaboration with Africa CDC, which with WHO in the African region are two sides of the same coin. Strengthen equitable access to the various decision-making posts, implement the transformation objectives of WHO by continuing the action started by Dr. Moiti and encouraging states to engage more. Madam Chair, honorable ministers and delegates, this summarily presented is what I hope to do at the head of our institution if you bestow your trust in me. The actions will be based solely on the needs of our population and the states that you ministers of health represent. As you see, these priorities are interconnected and they are articulated around the health system, that is service delivery, health workers, health products, vaccines, and health technologies, health information, financing, and governance. My profile suits the implementation of these aspects because I'm an academic. I've held post of responsibility at national level in the health sector, and I have also managed continental institutions in charge of health. Innovation would guide the actions that I will lead with you, and full involvement of communities in the implementation of primary health care, in the healthy management, sane management of resources, strengthening of public-private partnership, and raising professional consciousness of health workers and effectiveness of universal health coverage in our continent. Together, we will make our continent a space where priority to health is not just a slogan, but a reality. I thank you for your kind attention.
Ladies and gentlemen, with your permission, I would like to say a few words in English.
You are muted. Can you kindly unmute yourself, Professor?
My name is Moustafa Mijiyawa. I'm from Togo. I worked as professor of rheumatology for 25 years before serving as Minister of Health for 9 years in my country. I thus had the opportunity to manage epidemics in my country's entire health system. My 9-year experience has given me the opportunity to become familiar with continental and international institutions involved in health. And my background as professor of rheumatology and minister of health has equipped me with the skills I need to collectively manage WHO Africa with you. You can trust me, and I know I can count on you. Thanks. Obrigado.
Thank you, Professor Moustafa. We'll now continue the interview with questions and answers. I will now pull the first token with the name of the regional committee member which expressed their wish to ask a question to Professor Moustafa. Central African Republic. Central African Republic, you have the floor. Can you kindly unmute yourself? The representative from Central African Republic.
Merci beaucoup, cher professeur.
Thank you very much, dear professor.
Quelle initiative mettriez-vous en place?
What initiative would you implement to reduce health inequalities between rural and urban areas and amongst different socioeconomic groups? How do you intend to bring greater equity in the representation of member states within our organization? I thank you.
Merci aux délégués.
I'd like to thank the delegate of the Central African Republic. The first question, because you asked two questions actually. The first relates to the principle of reducing inequality between rural and urban areas. And that question is all the more relevant and interesting as it falls in line with one of the priorities I explained, that is universal health coverage. We know that rural areas are often left behind, and universal health coverage is one of those mechanisms by which we can reduce such inequality. So to implement universal health coverage, we need, of course, to increase the health budget and then to carry out advocacy with states for universal health coverage. And that requires also working with the most disadvantaged population groups, which are in the majority. That is what we've been doing in Togo since January 2024, making health insurance mandatory to be sure that it covers the entire population, encourage health organizations within the communities, because it will help our rural communities clearly. And then also encourage the private sector. And in that case, there is a second aspect. When you look at private insurance today, it focuses mostly on curative services. But we can convince our friends of the private sector to invest more in preventive services, and which will lead to a reduction of services, And of course, as part of universal health insurance, we need to think of the most vulnerable groups, that is, who live amongst rural communities. So that is what I can say in summary, in terms of reducing inequalities, and adding also that, of course, there are other factors that do not depend on the health sector. And of course, the Sustainable Development Goals, especially those related to poverty, sanitation, hygiene, and provision of drinking water. So that is the answer I can propose to your first question. Now, Madam President, can I move on to the second question?
Oh, please. Just one question he was entitled to. I will now select Saitomi and Principal to ask the question, and I'll give them the floor. Saitomi, are you there? Seychelles.
Merci, Madame la Présidente.
Thank you, Madam Chair.
Ma question est la suivante.
Here's my question.
Professeur, pensez-vous qu'il y a
Professor,
un peu trop de
don't you think there is a bit of duplication in the work of WHO in the African region? And maybe it is for that reason that we do not see a lot of results in terms of health on the continent.
Merci au délégué.
I thank the delegate from Seychelles. Well, I suppose that what you mean by duplication of work in the African region is the absolute need for coordination at all levels. First, within countries, and with the various partners. As Minister of Health, I observed that the same topics, the main targets were called upon to intervene, and their interventions were not coordinated, the various partners. And I think that is part of the advocacy that we should conduct with our friends ministers of health, to request that all the partners, when they intervene, it should be on the basis of consultation. They should work together. For instance, we cannot imagine regular meetings or hold regular meetings to know what the other partner is doing. In relation to the National Health Development Plan, that has been adopted. That will avoid duplication. And that will enable us to be more efficient. Now, at the continental level, a while ago, I said that the African region and Africa CDC, whose first board of administration I headed, should work together in a concerted and coordinated manner and make us more efficient. It should also be noted that the two principals, that is Dr. Moiti and Dr. Kasela, we realize that there is greater coordination so that these two continental bodies are not dueling together, but working as partners. They work in synergy. So that is the answer I can provide to your question. Thank you, Professor.
I shall now give the floor to the Gambia to ask the question. Gambia, are you there? The Gambia, can you kindly ask your question? If you are muted, please unmute yourself.
Okay, thank you very much, Madam Chair, and your brother out there. As a continent, we have this current issue of procurement of relevant drugs, more so in our part of Africa. Sometimes this has to do with the volume, for individual countries. Do you have any plans in place, to see how this could be eased, for most of us?
Merci à mon frère.
Thank you very much, brother from Gambia. The question you ask is both crucial and pertinent, and we've experienced it. We experienced it during COVID-19. And that is where the opportunity arose for grouped procurement, grouped ordering of medicines. Of course, each of our countries is of a different size, has a different sized population, and individually we don't carry much weight, which is why we need grouped procurement that makes things more fluid and makes medicines less expensive. We saw this in the initiatives that were undertaken by our heads of state. We saw this under COVID-19, and that is the road to follow. This is also true when we think about setting up local production units. In other words, we need to have regional hubs. We can't imagine that every individual country will be manufacturing goods for itself. We'll need regional hubs, and that means we'll need to place grouped orders, opt for group procurement. That will improve matters and will improve the volume of our orders and reduce costs. So I think that is an outline of what we will do in terms of buying medical products and medicines. We can also note that collaboration with Africa's CDC was of the essence during COVID-19. And so we will draw lessons from that experience and look ahead, seeking to strengthen our group procurement efforts, which doesn't in any way undermine the principle of sovereignty of each of our individual countries. Thank you.
I shall now give the floor to Zimbabwe to ask the question.
Thank you, Chair. Thank you, Professor Moustafa. With the withdrawal of 18% from financial support to WHO, how do you envision the role of WHO in Africa evolving over the next 5 years? Thank you.
Professor Moustafa.
Oui, merci à mon frère.
Thank you very much to my brother from Zimbabwe. It's true that financing is very important. It's one of the pillars of our health system, and it's also true that we're crossing a particularly different period in time with certain important partners withdrawing. The first thing we'll need to do is focus on advocacy in our countries to increase, to bolster health financing. And when I say funding health or financing health, that isn't simply looking at the monies allocated to the health ministry. I'm thinking about all health determinants that have an impact on health. Of course, in many of our countries, water stewardship is different. It doesn't sit in our health ministries, and we know that a significant parcel of our population doesn't have access to drinking water. So when we look at financing for drinking water, this has to be encouraged by the health ministry as well. And so there is the money allocated by the state. There's also innovative financing to consider. I propose that we add cosmetic products to the list that we are already familiar with, products that are taxed. And we also need sound management, strict management. The fewer resources we have, the more rigorous, the stricter we need to be. And I was talking earlier about our partners. There is need for coordinated action on the part of ministries so that we have greater energies, greater efficacy in all our actions. And often when we talk about financing and resources, we think about inflows. But sound management is fundamental if we're to increase the resources available. And it also allows us to be more efficient. The current situation is going to encourage us even more to look inwards and to count on ourselves, first and foremost. And this is the kind of advocacy I hope to lead if I have that role, working with the different authorities in the different countries. We also need, as I've said, and I repeat, good management to motivate the different partners. Thank you very much.
I shall now give the floor to Ghana to ask the question. Ghana, are you there? Kindly unmute yourself. Ghana, are you there? Are you ready? If not, I will ask another member state. Uganda. I will now give the floor to Uganda to ask the question.
Did you say Uganda? Chair, I hope you can hear me. Thank you, Professor Moustafa. My question.
No, Uganda, we are not getting you. Can you restate your question? No. Uganda, there are some challenges. Can we call you later?
Offices for enhanced support to the countries.
Did we say Ghana or Uganda?
Uganda, can you repeat your question? Uganda.
Okay, Uganda. Thank you, Professor Moustafa. Given the dwindling resources, the question is, how do you propose to strengthen WHO country offices to enhance their support to the countries?
Merci.
Thank you. My brother from Uganda. How to strengthen country offices? That's a very interesting question. And it underpins one of the transformation concerns of WHO. The first thing will be to take into account the specific needs of each country. And very often, WHO support is technical in nature. We saw this in Togo when we had to deal with epidemics. We were able to collaborate with the country office of WHO, and based on the needs identified, WHO the national team. Similarly, also through WHO, we benefited from advice and tools, namely equipment adjusted to the needs in the country. So, in other words, it's WHO that's mobilizing staff and expert knowledge, and that allows us to support where support is needed. That, of course, requires the coordination I spoke of earlier and the contribution and support of the different partners. Our country offices should be set up in such a way that they are country-specific, adapted to the country. We can't have one-size-fits-all model. But this means that the Ministry of Health of the country will need to coordinate closely with the national representative of the WHO in order to identify needs as required, and so that the WHO can then propose how it can contribute, how it can support the country. At the same time, other partners who may also have contributions to make to resolve a given problem, those partners need to also liaise with the national WHO teams so that there's coordinated, concerted, and efficient action. Thank you.
The total time for the interview has been exhausted. Thank you very much, Professor Moustafa, for being with us today. And this concludes the live forum for candidates for the WHO Regional Director for Africa. I would like to thank all member states of the WHO region and the candidates for having joined this forum today. We had a rich exchange, which will be valuable to member states in their assessment. I also personally want to extend my thanks and appreciation to the RD, Dr. Chikwe, for the hospitality that's been provided in the environment for us to have this forum. I'd like to thank the Secretariat for organizing it, and I can assure you that the member states in May will make the best election. I wish you all a good day and look forward to seeing you in person in Geneva on the 18th of May, 2025 for the second special section of WHO Regional Committee for Africa. There's a saying that you leave the best for the last. So permit me to introduce myself. I'm Dr. Louise Mapleh Kpoto, and I'm the Minister of Health of Liberia. I served as the second vice chair for RC 74, and currently I chair this section for and on behalf of the member states. Thank you for having me as your chair.
Thank you.
Yeah.
Merci.
So I hereby, with the power vested in me by the regional director, declare this section closed.
Thank you very much.
Yeah. Merci beaucoup. Merci, thank you. Obrigado.
Good luck, everyone. Good luck. See you.